I'm Dr. John Abebe, the Medical Director of Abebe Fertility Center, and you're once again welcome to our video series on our IVF process at the center. So today we'll be talking about oocyte retrieval. And what this means is that a patient has gone through controlled ovarian stimulations with injections. She's been on injection for about 2 weeks, and she has a lot of follicles with eggs, and it is time for us to retrieve the eggs. All right. Like usually what will happen is that this patient would have had a last injection, which is the trigger injection, the human chorionic gonadotropin injection, 36 hours before the day of the retrieval. The patient is usually asked to come fasting because the process is done under anesthesia. So for us at Abebe Fertility Center, we do our oocyte retrieval usually in the mornings. So what that means is that the last injection would have been taken in the evening, 36 hours prior to that time. So the patient is counseled on some do's and don'ts. So patient should not have any perfume or deodorant on. Patient should just take a bath and douche, all right, and then come in for the procedure. The patient should be in the center at least 30 minutes before the scheduled time for the procedure. Typically, the procedure will last between 15 to 20 minutes, except of course when there are so many follicles that needs to be drained, and so the time will be a bit longer than that. All right, so the process is done, and each of the follicle is drained, and as you drain the follicles, they drain the fluid. The eggs will come along with the fluid, and then that drained fluid is passed on to the embryologist, who will now screen and pick up the eggs from the fluid and go on to do the embryology work. Now, once the process is over, the patient is up from the theater, taken to the recovery room, and once she's recovered, she will be given some prescriptions, some medications to take after the procedure that will include antibiotics, analgesics, and the patient is also asked to commence the progesterone injection, gestone, which she will take daily until the day of embryo transfer, which is the last day she takes the injection for. We normally do our embryo transfer 5 days after oocyte retrieval, except otherwise stated. It's important to also know that patients will be seen on the second day post oocyte retrieval, just for checkup and to see how the patient is doing, and the patient will be updated on the status of her program, how many eggs were retrieved, how many got fertilized, and then how she's also will be given update as to when the transfer will take place. So that is how we can go ahead with our oocyte retrieval during the IVF process at the Abebe Fertility Center. So see you in our next video. God bless and have a wonderful day.